Hello and welcome to our new episode. This episode is all about liver health. World Liver Day is celebrated annually on April 19th to raise awareness about liver related issues. And this year's theme is Food is Medicine, emphasizing nutrition's role in liver health. Your liver is your body's detox powerhouse working 24/7. In this episode, let's explore how right food choices help in protecting, healing, and rejuvenating this vital organ. We speak to Dr. Sonal Asthana, lead consultant and multi-organ transplant surgeon. With over 20 plus years of experience, he holds an MSc from Alberta University, Canada, and also a fellowship in multi-organ transplantation. Currently affiliated with Aster CMI Hospital, Bengaluru. Hello, doctor. Welcome to the show.
Thank you for having me. It's a pleasure to be here.
Oh, same here, same here. And I'm very excited to start this conversation because liver as an organ is not much spoken about, right? So, and the theme for this year is food is medicine. So, let me start with that. Good diet or bad diet, how does that affect liver?
No, excellent. I think that you started with a theme which is very appropriate. Food is the oldest medicine known to man. You are what you eat. And especially liver is the organ that actually works the hardest in your body. It is the hardest working organ that you've never heard about.
Sure.
So the liver has more than 500 functions, and it essentially is your body's engine. Yeah, it's like the carburetor that keeps the body running. Everything goes through the liver at some point or the other. So clearly whatever you eat has a big impact on your liver. So over centuries, since we've evolved into human beings, our diet has shaped how we have responded in different climates. Clearly the requirements for, say, India are going to be different from people who live in North America or in the Arctic, for example. There are definitely, and the body has, the beauty of the body and the liver is that there's a huge amount of flexibility. So yes, the short answer is food can be medicine. Food can definitely impact your liver health for better or worse.
So now that you said food can be medicine, let's talk on the positive note at the beginning. I'm sure we have a lot more to cover in this episode. What are the best foods as per you for good liver?
So the best foods, as per me, or as per actually science, for the liver, or for the rest of your body. The liver isn't separate from your body. It's like all your body's parts work in unison. Anything that is fresh grown comes from the soil. Anything that your grandparents recognized as food that doesn't come out of a box or a carton is probably a good way to start. It's probably a good place to start. The reason, let me talk about that, split it up into two things. Firstly, why did I mention grandparents?
Correct.
So because if you realize it, our food patterns have significantly shifted in the last two generations. So we have moved from more traditional cereals, for example. India is a cereal consuming country. We moved from bajra, millets, ragi, which is the staple in Karnataka, to foods with a higher glycemic index like polished white rice and wheat, etc. So clearly whatever we are getting from the food right now, the nutrients are not the same as were being delivered 2 generations ago.
Right.
So that's probably number one. The second is, why did I talk about boxes? Because most of the food that we seem to eat today seems to come out of wrappers, cartons or boxes.
True.
So that invariably means that foods that are processed with a lot of additions or additives that have gone into them are actually part of our diet on a regular basis. So those are probably the two simple things that I would say that would sort of point you in the right direction. Clearly there's a bunch of other things as well. Anything that you eat, such as whole grains, pulses, dried nuts, which are high in energy, a protein dominant diet as opposed to a carbohydrate dominant diet are things that are actually good for your liver.
Okay. So now that you said boxes, we live in the generation where, we are 24/7 busy, right? I agree that we all need to cook fresh food, eat good. I completely understand. But at the same time, how does, highly processed food, how processed food is full of sugar and salt, how does that affect liver? If you can simplify the science for us.
As you correctly say, most processed foods have a very high amount of sugar and high amounts of salt. So what is the commonest cause of death today in the Western world? It is hypertension. It is predominantly linked to the amount of salt that you take. Okay. The amount of salt that we take today or the amount of sugar that we take in our lifetimes is 5 to 10 times what our ancestors used to take.
Okay.
Okay. The amount we take of fiber that we take in a diet is 1/5 of what our ancestors used to take. So clearly, when you look at the differences, the amount of roughage that is required to make sure that your bowel function is good is actually 1/5, and the other things are 5 to 10 times more. So, how does sugar and salt affect you? Again, salt is essential for body function, as is sugar. It's important as a source of energy. So, when someone takes a sugar, for example, it is processed, absorbed from the bowel. It goes directly into the liver for processing.
Correct.
Now, the liver will actually process it and send it to the rest of the cells of the body for utilization, because all cells need energy. When there is extra sugar, it will be stored in the liver as glycogen, and which is then later converted to fat. Now, suppose I drink a cola, or I eat one of those sugar-filled candy bars. There is a sugar spike. So suddenly you're buzzing with energy. You heard about sugar rushes that everybody gets them, right? And then you're full of energy at that time. What happens as a consequence of that? The insulin levels, which is the body's hormone to reduce the sugar, actually spikes at the same time. So you have a spike and then there is a crash. So immediately after eating something, you might feel a rush. After that, you'll feel a completely a low amount of energy, and people will actually feel hungrier after that. So if you've taken something that is high in sugar, one is that you're actually disturbing your body's metabolism, and you're also setting yourself up for eating more than you need, because the body's response after that to high insulin is to eat more food. Secondly, what happens to all the extra sugar that you take?
Right, that was the question. So what does,
Exactly. So right now, for example, when our ancestors who used to walk everywhere, or essentially be a lot more physically mobile, active than us, required about maybe 1800 to 2000 calories a day. Now, most of us spend time on a screen. Most of us do not walk as much. So our caloric requirement is probably less. But our caloric intake has increased significantly more. So if you actually have a nice South Indian breakfast, you get 1400 kilocalories.
Okay.
That is 75% of your body, your recommended intake for a day. So most of us are eating more than we need. Okay. So what happens to the rest of the sugar? Where are the rest of the calories going? So they can obviously be stored in the liver temporarily as a glycogen, but most of them get converted to fat. So fat deposits predominantly in your liver, but also deposits elsewhere in your body. Okay. And the Indian fat distribution is very, very different. Because our genes have evolved, like I was the point I was making, are very different from, say, people who lived in Africa, people who lived in Europe and North America. Our genes have evolved to process food very, very differently. So we tend to retain a lot of the fat and carbohydrate because of the starvation cycles that we've gone through in the past, actually. So unfortunately, it's bad news for us. We have bad genetics and bad food. All of this will deposit into your liver, into your heart, calcify your heart vessels, and then make you obese.
Does this also mean that your liver works harder than what it should, and that actually harms?
Absolutely.
Since we're talking about bad foods, like the processed, and how does this affect the liver, what are the other things that actually we're doing that is actually damaging the liver?
Sure. So again, we're talking about this in Bangalore, which is the Silicon Valley of India. So it's probably a good time to talk about how the IT sector is impacted.
Right.
So as we were discussing before, this is an interesting study that's been published in the journal Nature about workers in the IT sector from Hyderabad. 84% of people surveyed had liver disease. Now, why is it commoner in certain groups of people, and what are the things that are probably negative for the liver?
Right.
So the first thing, of course, we've talked about is diet. Food is the theme of this year's World Liver Day, and that's probably the most important. The second as important thing is activity, exercise. Most of us are sedentary. Most of us sit for a large portion of the day on a desk or in front of a computer, in front of blue light. Most of us do not get a requisite amount of movement. So now, of course, we know that it's good if you're above the age of 40, for example, to have some sort of weightlifting routine so that you can preserve your muscle mass. The second is the 10,000 steps a day. You don't have to be a runner, you don't have to be a marathoner. Even if you're able to walk 10,000 steps a day, that is activity. So bad food, low activity, disturbed sleep cycles, which is extremely common to the IT sector because they work on shifts, and the disturbance in sleep cycles, getting less than 8 hours of regular sleep a day, is in itself an important stressor.
Okay.
The fourth thing is alcohol consumption. Now, for example, in the IT sector, there's a higher preponderance towards binge drinking because on the days off, for example, Saturday and Sunday, a lot of drinking is crowded into a relatively short period of time. So these are obviously behaviors that are harmful to the liver, and that's why certain sectors have high incidences of liver disease, which is very scary because these are young people. We know that all these people with fatty liver, a proportion of them will move on to liver cirrhosis and liver failure. So if not now, then 10 to 20 years from now, we will see a large number of people coming in for liver failure requiring a liver transplant because of the choices that are being made right now.
And these days, a lot of them talking about fatty liver, right? So I want to understand how should people with conditions like fatty liver disease or hepatitis modify their lives?
Okay, sure. Now, hepatitis by definition basically means inflammation. So, in medical parlance, anything that ends with itis basically means a swelling or an inflammation. So, when we talk about fatty liver, for example, now fatty liver is something that has become more prevalent sort of in the last 2 decades or so. Now, probably 50 to 60% of urban India has some sort of fat deposition in the liver. It is a direct consequence of our diet and of our lack of activity. Okay. Of course, there are some, I don't want to oversimplify it. There are obviously certain familiar characteristics. For example, some people have a higher incidence of, familial history of liver disease. But what we understand now about this is that certain diseases such as fatty liver, heart disease, obesity, diabetes, they work together and high cholesterol as what is called metabolic syndrome. So all of these diseases tend to occur together. Again, going back to some recent literature, one of the commonest cause of death with people with fatty liver is actually heart disease, because these actually happen to the same group of people.
Right.
So fatty liver is one cause of the hepatitis, and it certainly is not benign. It is not something that you should ignore if you come across. So the first question if you have fatty liver is to see whether the fat is causing inflammation in the liver or not, which is where the hepatitis angle comes in, which is done by a simple blood test. This is a liver function test. The treatments are different if there are inflammation or if there is no inflammation. The best cure to a fatty liver disease is weight loss, controlled weight loss of approximately 10% of the body weight. And again, we are back to diet and exercise.
Right. And we also spoke about alcohol, doctor.
Yeah.
A person with a history of alcohol, can that person undo the damage with the diet? Is that possible?
Sure. So it's a true story. I mean, I'm going to tell you, start with a myth exactly. So back in Greek mythology, there was this gentleman, Prometheus, who actually stole fire from the gods to give to human beings. So because of this deed, he was punished by the gods. So Zeus actually tied him to a stone. So the story goes that he was tied to the stone, and every day a vulture would come and eat up his liver. And every night the liver would grow back.
Okay.
So this basically just shows that even in the times of the Greeks, actually, people knew that there was a potential for regeneration in the liver, that the liver would grow back. So liver that way is fantastic. When we talk about detox, cleansing, etc., the liver does all that. We don't need anything. We just need to exercise and we need to eat right. The liver is going to manage the rest of it for you. So that is exactly. So if there is something that is causing damage to the liver, or if you have alcohol or some sort of toxin that is there, if you remove the toxin, then the liver has a very high chance of regenerating. Of course, there is a limit to this. So if there's been sort of alcohol excess, it has caused permanent damage called cirrhosis to the liver, then of course the possibility of regeneration is a little lower.
Okay, so it's not that anyway I've started drinking. My liver is damaged anyway, so let me continue drinking. So it does not go by that.
No, I think that any time when you stop is a good time.
Right. And like you said, liver generates itself, right? That's the only organ, if I'm not wrong.
That's correct.
Doctor,
Yeah,
right?
that's right.
How much of it can that be regenerated?
Quite a spectacular amount actually, because we do a lot of liver operations for things like liver cancer, for example. So we know that we can remove up to 75% of a normal liver without actually impacting the body's function. So even if the liver remnant, as we call it, even if we have 30% of functioning liver, that itself can grow back to almost 100% in a period of 6 to 8 weeks. So the liver has a lot of regenerative capacity.
Doctor, normally when it is a hand pain, eye pain, leg pain, stomach pain, we understand, okay, now this is the pain. But there is always confusion with respect to gallbladder pain and liver pain. Is there a way one can identify this?
Sure. One of the negatives about the liver is that it is a hardworking organ and it doesn't complain at all. So by the time we find out that there's a liver problem, it's usually quite advanced. And in fact, one of the common causes why we find out the problem people have liver problems is they come to us for executive health checkups. Relatively few of the nerves that actually control that sort of measure pain. So the amount of pain that can actually be generated by liver swelling is relatively low. If there is a sharp pain in the body, it is more likely to be related to gallbladder. Most liver conditions do not cause pain. Most liver conditions are painless. The problem that we face as liver specialists is most of these signs come in very, very late. As we have discussed, almost 75% of the liver can be damaged before people actually developing any symptoms. So by the time you develop symptoms of jaundice or water buildup in the belly, leg swelling, occasionally blood vomiting or mental confusion, that is usually a sign of end-stage liver disease. That is usually quite late in the presentation of liver disease.
So then what should one do?
So the best thing is to be proactive in seeing how one can prevent such problems from occurring.
What is one common mistake that we are doing with respect to our liver health?
Certainly the common mistakes that one makes is probably a mistake of a lack of information. That most of us believe that, because our carbohydrate intake is very high. Most of us believe that whether you're eating rice, wheat, etc., it's the same, or bread, it's the same. But they're actually not the same. So, for example, polished rice, basmati rice that you have has a very high glycemic index. But if you look at other kinds of cereal, such as bajra, millets, and ragi, they actually they're complex carbohydrates. So the way they affect your body is very, very different. Take advantage of whatever has been available in India for generations is probably the best way you can sort of reduce your risk. That is probably what I would say. Yeah.
But then the quality of maybe ragi 2 generations ago was different from what it is today, right? That also damages.
So excellent point again. So now we know that a lot of the crops that are grown are very, very different from the crops that are available before.
Right.
So this makes a very big difference in the glycemic index, for example. So there have been some interesting studies on this as well. So for example, the crops that were introduced during the Green Revolution, which is obviously a great thing for India in the 70s, those crops were genetically distinct from the crops that had been grown in the past actually. So these crops actually had higher glycemic indexes. So places where you had a very strong influence of the newer crops, for example, Punjab, for example, they have higher rates of diabetes, etc. now, 20 years, 30 years down the line after these crops were introduced. So I think that it's an important point that decrease in fiber has impacted us quite significantly. Again, those are consequences of the Western diet because a lot of Western diets are very low in fiber. That was not the case in India before. For example, fresh fruits, veggies, etc., that we used to consume more in the past had a lot more fiber.
Doctor, we'll now move to another segment where a lot of social media influencers talk about drink this for liver detox. Liver itself is a detox organ. Isn't it a scam? I mean, please clarify.
So I think that most of the time, the 2 points that I would like to make here is that your body is a lot more flexible than you think. Clearly, you can understand this. There is no genetic difference between yourself and somebody who's living in at minus 40 degrees in Alaska. Now your body has adapted, the same genes have adapted to living with a completely different set of diet in, say, the Arctic Circle as compared to India.
Right.
So there's a very big range of flexibility in your body's adaptability. Secondly, the liver itself, like you say, is actually responsible for its own detoxification. So the one thing that I would advise is that do not reach a stage where your liver reaches need detoxification. And secondly, all that you really need to do is to eat right and exercise. And most of the time, the liver will be able to come around by itself.
Thank you. And a lot of people debate about coffee is good or bad for liver. Your take on it?
So I was just having a cup of black coffee before we started this conversation.
Podcast, yeah.
So coffee is the one thing for which we have a good amount of evidence for the liver because the coffee actually has a lot of caffeinoids. It has a lot of antioxidants in it, which actually reduce the amount of inflammation inside the body. So it certainly is good for the liver. It is protective for the liver, even in certain viral infections such as hepatitis C. It has been well studied that coffee intake will actually decrease the amount of damage that these infections do.
Okay.
But it has to be black, and the coffee has to be drunk. You have to have at least 4 to 5 cups a day for the liver protective effect.
Not with sugar.
Not with sugar, unfortunately.
Right. Somewhere, tattoos and body piercings are linked with liver. Is it true?
So again, it depends on. I mean, there are 2 points to know about tattoos. Firstly, tattooing itself, any sort of injection in the body, can introduce viruses. So certain viruses such as hepatitis B, hepatitis C, and HIV can go in from infected tattoo needles. Okay. So if for people who are into body art, probably going to a place that is safe and secure, where you know that the needles are going to be safe, is very, very important. Okay. The second is, again, going back to the quality of the ink that is used. In some situations, we do have some hyperallergic reactions to some of the inks that are used in the tattoos as well. Those are relatively less common as compared to the incidence of hepatitis C. A lot of the hepatitis C infections that were commoner in the West in the 2010s were linked to blood transfusions and tattoos.
Okay. Doctor, I'm almost at the end of the show. So before we wrap up, I would like to ask you any golden rule that you would like to tell our viewers. How do they take care of their liver health?
Sure. So there are several things that you can do to love your liver. The first thing is to eat right. So eat what your grandparents ate is actually a good measure. Green vegetables, fruits and nuts are actually extremely good for your body. An adequate amount of hydration. You don't have to go crazy, but at least drink about 2 to 3 liters a day, which is very hard to do if you're working in an AC environment because you often lose track of how much water you're consuming. Stay hydrated. Dry fruits and nuts. Avoid processed foods. That's probably our diet. The second is exercise. Again, you don't need to be Arnold Schwarzenegger. You need to just take care of your body. How do you do that? One is by getting at least 60 minutes of exercise every week where your heart rate rises. Exercises means when you talk about walking, it's not just a walk in the park after dinner. That's not what we're talking about here. We talk about something that causes your heart rate to rise. That is exercise. So ideally 10,000 steps a day. If you're above the age of 40, please consider doing some weightlifting. Again, within reason. It's important because you will lose 1 to 2% of your muscle mass every year after the age of 40. Having an adequate muscle mass is the best predictor of good function above the age of 60. And practice safe sex. Do not share toothbrushes or intimate items. Okay. Vaccination. Hepatitis B, hepatitis A have excellent vaccines. If you aren't vaccinated already, make sure that you are vaccinated.
Your liver works harder, so give it the care it deserves. With this, we wrap up today's episode. Doctor, it was very nice talking to you. Thank you so much for coming to our studios and sharing your experiences and thoughts.
Thank you very much for having me.
Thank you.